I am Dr. Kivumbi Jamil. I work with Bones and Muscles Clinic here in Wandegeya. I happen to know about bones and muscles and the nervous system in the body. Today I want to talk about lower back pain as one of the common issues in the community. So many times you have seen people going to the gym, going for swimming, jogging around home to manage their back pains or to manage different pains in the body. Those are some of the remedies that people sometimes read on the internet and follow. These days they have invented a word called internet doctors, that people who are not necessarily qualified doctors can also become doctors via the internet. It has some challenges, and quite the challenges are many. I want to bring the point of lower back pain and how you can manage it properly. And we want to confirm, is it true that you can go to the gym, you can swim, you can jog around, you can run, you can walk, you can do sit-ups and cure back pain? We want to confirm that today. Now this is what happens in the lower back. The lower back has about 5 bones in everybody, young or old. These 5 bones are arranged in a way that the spaces between each one bone to another is the same as the space from that very bone to the next. So it is aligned in a way that the bones give each other similar spaces as you move towards the bum or towards the tailbone. Now these spaces are supposed to be maintained, and that's how you live a normal life without lower back pain. And the muscles on these bones must be in good state. They shouldn't be strained, they should not get injuries, they shouldn't be having any problems. So in old age, those are people about 45 years and above, they can have lower back pain as a result of degeneration of these bones. These bones are called lower back vertebral bones. They can become smaller than normal. We call that spondylosis. Degenerate and become so small that the spaces between them also shrink or widen. If they become so small and the spaces widen, you can get the disc between those bones prolapse. If they become so small and the spaces narrow, you can get the nerves that pass from those spaces into the legs to be compressed. So in each case you get pain in the lower legs, in the lower limbs. So you get pain from the waist up to the toes. Some people report burning sensations, others say they have tingling, others say they have paralysis. These are all clinical presentations of the same pathology, of the same disease. Now, that is for the people who are aging, who are old. What about people who are not 45 years and above, who are below? What could be the common causes of lower back pain in that age group? It can be maybe urinary tract infections. It can be a problem in the abdomen. You can be having maybe a problem with your intestines. It can be an issue with the kidneys. It can be an issue with any organ in the abdomen. Organs around the abdomen can project pain, can send pain to the lower back. And somebody will come to the hospital or clinic complaining about lower back pain when the cause is actually intra-abdominal, when the cause is coming from the front, from the abdomen. Now, what are other causes of lower back pain? You can get a road traffic accident. You can be inactive and obese. That's another cause. You can be having a congenital anomaly of the spine. There are certain people who are born with spines that are not in normal alignment, that are not presenting the way a normal spine should present. People born with kyphosis, people born with scoliosis, people born with exaggerated lordosis or even reduced lordosis. Some people go and do x-rays of the lower backs when they have lower back pain, and they end up viewing something accidentally which they didn't know about themselves, but it was there since birth. So those are some of the things that cause lower back pain. How do we go about it? First of all, it is true that when you are active, jogging around and doing exercise, you maintain a good body weight. That is okay, but it is not curative. It only prevents you from getting lower back pain. Secondly, if you are skipping a rope, running around, walking, it is true that you can have a good weight, you can have the body muscles fully active, you can have yourself in good weight, in good health status, but you cannot cure from lower back pain. Lower back pain cures through treatment and investigation, because you have to rule out what is really causing the lower back pain. And it is the cause that leads you to the treatment. Without knowing the real cause of the problem, you cannot manage it. So people who just look at the patients and then suggest things that are causing the lower back pain are wrong. You have to investigate. If you have a skill around that area of bone and muscle, you can investigate. There are quite many people now around the country who know about this. Now, the management depends on the cause. That's why it is not clear, it is not proper to suggest a particular management protocol. The management will always depend on what has caused the lower back pain. But is it true that the exercises you do home, and the jogging, and the steaming, the saunas, the massage, is it true that they can cure lower back pain? No. They can only be preventive measures, but they cannot cure a disease that has already set in. But swimming particularly can be part of treatment. Sometimes we tell young people to go in the swimming pool and swim as part of treatment. It is both preventive, but also can be somehow therapeutic. So swimming particularly can help you to align your spine properly, and you're able to heal from these syndromic pains of the lower back, which are not necessarily pathological in nature, but they have been caused by maybe positionings, maybe certain postures, sleeping postures, maybe your way of life. So those ones can really be cured by that. Now, for people who have bigger bellies, who have a bigger stomach, those people also run a risk of having lower back pain. Because if you have a congested abdomen, you put a lot of stress on the abdominal muscles. And if you have stress on the abdominal muscles, those muscles can radiate pain into the lower back. So some people feel pain in the flanks, in the sides, and in the lower back as a result of their natural appearance, or the way their abdomens are. So having a tummy that is relatively small or reduced can also help you to cure a lower back pain. My name is Kivumbi Jamil. I'm a specialist in bones and muscles, and I work with Bones and Muscles Clinic in Wise. And my telephone number is 0759 946471. So it is 0759 946471.